Alrighty. Well, hello, everyone. Thank you for joining us for our virtual open enrollment seminar. At this time, we will go over Delta Dental benefits for plan year 2025. Before we get started, I would like to brief everyone on a couple of housekeeping items. All attendees are muted and will remain muted throughout the presentation. If you have a question, please type it in the chat box located on the right-hand side of the presentation screen. Be informed that if you type a question in the chat box, everyone attending the session will see your question and your name. So if you have a question that is sensitive or confidential in nature, we recommend that you reach out to the County Benefits Division or your department's benefits ambassador. Lastly, today's seminar is being recorded and a copy will be posted on the Benefits Open Enrollment website. At this time, I will turn it over to our presenter, Marissa Hakala.
Thank you, Nidra. Thank you, everyone, for joining today. My name is Marissa Hakla, and I have the pleasure of working with the County of San Diego at Delta Dental. And so I am here today to present on the plan year 2025 benefits through Delta Dental that are offered to you and your dependents. With that, I will take my camera off just so that it's not distracting so that we can go through the presentation. Today, what we will be covering, we'll start with learning about the plans that are offered to you and your dependents. And then we'll talk a little bit about Delta Dental and our different networks that are available through the various plans. We will talk about some of the member perks that are also available, various discounts that we offer. We will also discuss the resources that we have available, whether they are through the web, our mobile resources, oral health and wellness resources as well. And then we'll end with customer service and how you can contact Delta Dental throughout the plan year. You have available to you. You have on this summary slide, you can see the high-level summary of the different plan options. So you have a Delta Dental PPO plan that is available to you. So this is a PPO plan, and we'll get into some details about what makes this plan so different later. But basically, you can visit any licensed dentist under the PPO plan. When you access the PPO plan, you have a number of services that are covered, and you pay based on the coinsurance for the types of services that you are having done. There are deductibles and maximums on the PPO plan. And the preventive care, like routine cleanings and exams, are covered at no or low cost to you. So as I mentioned, with this plan, you can visit any licensed dentist, but we will talk about the various networks that are available. Our PPO and Premier network of providers do offer discounts and help your dollars go a lot further on this plan. The Delta Care USA plan is the DHMO plan that is offered to County of San Diego members. When you enroll on this plan, you select a primary care dentist through our Delta Care USA network. When you access that, the benefits on this plan, you're going through your primary care dentist and the procedures that are covered, around 300 or over 300 procedures that are covered have specific co-pays applicable to them. There are no annual deductibles or maximums on this plan. And when you visit your primary care dentist, you pay the applicable co-payment for the services that are being rendered. The Delta Care USA plan is offered in California for County of San Diego members. Now let's dive a little deeper into the Delta Care USA DHMO plan. So as I mentioned in the summary slide, once you enroll in this plan, you can select a primary care dentist from our Delta Care USA network. When you select a primary care dentist, that dentist is the provider that you would make your appointment with for all of your dental care needs. If you should need a specialist for any particular reason, your primary care dentist would refer you to see a specialist for other services. When you access benefits on this plan, you have set co-pays, as I mentioned in that summary slide, that are applicable to the various procedures that you're having done. Again, preventive care services are provided at low or no cost to you under this plan. And there are no annual maximums or deductibles on this plan. No claims need to be submitted. You just pay the co-payments for the procedures as you go. A lot of members tend to ask, what is the best plan for me? And really the answer is always very specific to you personally based on the dental care that you need. I just would like to point out before I move on to the next slide, again, that this plan has no annual maximums. When we get into the PPO plan, we'll talk about how an annual maximum works on a PPO plan. But basically, that means that if you need a lot of work done, the Delta Care USA plan might be that plan for you just because you won't hit that annual maximum. You just continue to pay the co-pays for the services that you need as you go. So when you enroll in this plan, you can choose a primary care dentist either online by registering online at deltadentalins.com or over the phone by calling customer service. I think it's important to note that you can have up to one primary care dentist for each member of your family. You don't have to select one primary care dentist for your entire family. You can have one primary care dentist for each individual that's in your family and covered under this plan. Once you've chosen that dentist, you can make an appointment, then visit the dentist and pay the co-payments for any, if any, for services that were provided during that visit. So as I mentioned, how you choose your dentist under the Delta Care USA DHMO plan, you can go to deltadentalins.com. You can, when you first go onto the website, you can search for a dentist in the Delta Care USA network. And you can select various parameters for either your zip code, whether it be that you want a dentist that's close to home or close to work, and then select a dentist, then go online. When you register on deltadentalins.com, it then allows you to select that primary care dentist to be assigned to you. Or as I mentioned, you can call customer service to have that primary care dentist assigned to you as well. You can change your primary care dentist at any time. You simply need to go back online and make that change or call customer service to make that change over the phone. There is no limit to how many times you can change your primary care dentist. You just need to call by the 15th of the month for the change to be effective by the 1st of the following month. It went backwards for a second there. So for specialty and emergency care, as I mentioned, your primary care dentist, if you need any type of specialty care, your primary care dentist will refer you to a specialist in the Delta Care USA network that can provide you with that specialty care. For any sort of emergency procedures, if you are having a dental emergency and you are more than 35 miles away from your primary care dentist, You can go see another provider, and $100 of that service will be covered for emergency care. So typically what that means is that any sort of palliative care to help subside the pain will be covered so that then you can get in to see your primary care dentist. Um, and if you are having a dental emergency and you're not more than 35 miles away from your primary care dentist, um, that dentist must see you, within um, 24 hours of you notifying them of that emergency, so that, or make accommodations if it's, say, over the weekend and they aren't open during the weekend. They typically have a partner office that can see you. Switching from another plan. If you are switching into the Delta Care USA DHMO plan um, from another plan as of January 1st, if you started any sort of procedure, typically, for example, a crown is a multi-step procedure. So if you started, say, something like that under your previous plan, the previous plan would still cover whatever procedure you began under that plan. Coverage begins under this plan after January 1st. So if you start a procedure after January 1st, this plan will cover that procedure. Pre-existing conditions like missing teeth are covered under this plan. And if you're undergoing any sort of orthodontic treatment, you may be able to stay with your current orthodontist under the same co-payment schedule if you're coming from another DHMO plan. And if you're coming onto this plan and you're in the middle of orthodontic services, you would have that orthodontist reach out to Delta Dental to ascertain what your benefits were and what the benefits are that you're coming on to ensure that there's no disruption of treatment. For braces, under this plan, orthodontics are covered for adults and children. All phases of orthodontic treatment are covered under this plan. And pre and post records, tooth extractions are covered. And as we just discussed, coverage for in-progress treatment is available as well. Just to give you a high-level overview of what's covered under this plan. So for diagnostic and preventive services, you have one cleaning covered every 6 months, and most services under diagnostic and preventive, that category, are covered at no cost. Basic services like fillings, periodontal procedures, those copays vary, as well as for major services like your crowns, prosthodontics. So, certainly what I always recommend is that you can, when you enroll, register on this plan so that you can view the copayment schedule for this plan, and certainly be an advocate when you're visiting your provider if a treatment is recommended. Definitely check your copay schedule to ensure that you are being charged appropriately, because there are so many copayment schedules out there. It's always good to have that discussion with your provider, especially if they're suggesting something that maybe isn't on your copay schedule or is not covered, to understand if there is an alternative treatment that is covered under the copay schedule available to you through the County of San Diego.
Hi,
For
Melissa.
yes,
We had a question come through. If you can
sure,
go back to the previous slide
yeah,
regarding orthodontic coverage.
yes.
We had someone inquire if this was a new benefit under the plan because they have Delta Dental and it was not covered. So my thoughts for that is perhaps you went to a orthodontist who was not in the network. Can you elaborate more on that as well, Marissa?
Yeah, absolutely. Thank you. That's a great question. Nita, to your point, orthodontics yes, have always been covered under the Delta Care USA plan. As long as you are seeing a Delta Care USA orthodontist. So I apologize if I did not clarify that with Delta Care USA, the DHMO plan. The providers and services are covered with providers that are in the Delta Care USA network, and that includes orthodontists. So if you went to an orthodontist that is not in the Delta Care USA network, that could be why you did not have your orthodontic services covered.
Marissa,
Sure.
if we can address an additional question or concern about the
Sure.
orthodontist, um, we had a question come through. I've had a very difficult time finding an orthodontist in network. The list is perhaps outdated. Can we assist this individual on how to access a list or what would be the recommended steps to take?
Yeah, absolutely. So on our deltadentalinus.com site, you can, when you are searching, select the Delta Care USA network. And then once you get, and you put either a zip code, once you get to all of the results, then um, you can update the filters so that you can look for an orthodontist as a specialist. And some orthodontists maybe not accepting new patients. So you can also select there's a section that says accepting new patients. So you can select that as well. And then that should help you filter to the orthodontists that are available and they're that are accepting new patients as well. So that could be what this member, the issue this member has run into. It can happen from time to time when an orthodontist, may have too many patients and they want to ensure that they meet, the standard of seeing their patients within the required amount of time and ensuring that they have the capacity to see all of the patients that are coming to them.
Thank you, Marissa. Just a couple more questions we seem to
Sure.
have about orthodontists.
Yeah.
orthodontists.
Uh-huh.
So, when you say orthodontic treatments are covered, do you mean all of the phases of alignment, braces, Invisalign, or will there be some portion that we would have to pay out of pocket?
So I'm just going to go just two slides over because, and this is a high level summary and it does not show all of the procedure codes that are available for coverage under orthodontic care for the County of San Diego Delta Care USA plan. But the comprehensive orthodontic treatment has a copayment of $1,695 for the comprehensive treatment. So that's for the treatment that typically runs for 2 years. If it goes longer, there can be additional charges, but this does include pre and post treatment records. It does include, Nidra, to your point, if the member opts to have Invisalign, that is available as an option under this plan. And so that is something that is available. There are other phases of treatment that are listed with um, listed with co-payments associated with them. And so when I speak about that co-payment schedule, that is certainly where a member would go to see all of the co-payments and the procedure codes that are covered under this plan.
Okay, thank you, Marissa. I believe
Sure.
that's pretty much covers our questions for now. But I wanted to let the individual know who inquired about the website link for finding orthodontists under the Delta Care plan. I actually pasted a link to how to search for an orthodontist. Again, if you're covered under the Delta Care USA plan. And I believe we're okay to move forward.
Okay, great. Thank you. So now we will review the PPO plan and the benefits that and how this plan works. A little bit different from the DHMO plan. Under the PPO plan, you can visit any licensed dentist. However, if you visit a PPO or premier dentist, and I will cover that in a little bit more detail later on, but if you visit a provider that's contracted with Delta Dental, you definitely save the most, and your dollars go a lot further. So when you visit a contracted provider, you are not charged more than your expected portion or the co-insurance portion for the treatment you've had done based on that provider's contracted fee. And we'll touch on what happens if you go to a non-contracted provider, because that experience is a little different. And I just want to make sure that everyone is aware of how that is different. But definitely, if you're going to a PPO or premier dentist, your dollars go a lot further, and you are not charged more than your co-insurance portion of their contracted fee. When you enroll on this plan, you don't necessarily need an ID card, to access this plan. When you make an appointment with your provider, they will typically ask you for some information. You let them know you're covered through Delta Dental of California, and they'll ask you perhaps for your Social Security number, and then they will look you up on our website through their provider tools that they have available to them, so that they have all of the benefits and everything, and they've checked your eligibility, and they have everything available before you even walk in the door. When you enroll in this plan, similar to the DHMO, I really encourage you to create an online account and register so that you can, again, view your benefits online through this plan. Unlike the DHMO plan, claims are submitted on the PPO plan. So when you enroll on and register online, you are able to see your claims online, and you can even select to have your EOB statements available online, which just means that you get an email when when your EOB is processed. So that is really high level. Now we'll jump into the PPO coverage. So for this plan, there are deductibles and maximums, and the list is a little bit of what I mentioned earlier in the presentation. So there are deductibles. It's $50 per person, $150 per family. And regardless of what network your provider is in. The deductible is waived for diagnostic and preventive services. That's what that DMP stands for. And so that means if you're going in for a cleaning or exam or x-ray, you do not have to pay that deductible. It's only when you get into your basic and major services that the deductible applies. Great news, the annual maximum is increasing to $2,500 per person in 2025. It is a very, a very wonderful benefit. So that means that your annual maximum can, go further for you if you need more major services. Another change that is occurring for the PPO plan this year, in the past, if you were a PPO member, you might know that the orthodontic services under the PPO plan were only available through the DHMO plan, meaning that you had to visit a Delta Care orthodontist. Now, as of January 1st, 2025, you can visit any licensed orthodontist. And now that what will change is that your coinsurance portion, which I will show you on the next slide, will be 50% of that provider's hopefully contracted fee, because hopefully you will be visiting a PPO or premier dentist, at up to a lifetime maximum of $2,500 per person. So what that means is a lifetime maximum means that once it's exhausted or once it's used, it does not refresh like your annual maximum does for other services under this plan. For orthodontic services with a lifetime maximum, once that $2,500 is utilized, it does not refresh and cannot be utilized for another treatment. So under this plan, as I mentioned, diagnostic and preventive services are covered at little to no cost. So for PPO and premier dentists, 100% of their contracted fee is covered for diagnostic and preventive services. I mentioned non-contracted providers a little earlier. So you'll notice that 80% of the diagnostic and preventive services are covered with a non-contracted provider. That is 80%, that 80% coverage is of what the plan covers for non-contracted services. So you can potentially be balance billed over the 20% that is that coinsurance portion. So say, for example, the plan covers $100 for a cleaning, but the provider is charging $110. The plan would cover 80% of $100. So your portion would be 20% of $100 plus the difference between $110 and $100. So in total, you would pay $30 for that cleaning. That's just an example of what balance billing looks like. That is what occurs with a non-contracted provider, which is why we're always encouraging you to visit a PPO or premier dentist. They discount their fees when they contract with Delta Dental, and you don't have to worry about being balance billed. So under this plan, for basic endodontic, periodontic, and oral surgery procedures, 80% is covered for PPO premier providers and non-contracted dentists, 80% of what the plan covers for non-contracted dentists, and then 80% of the PPO and premier contracted fees. For major services, prosthodontics, implants, it's 70% of the PPO or premier provider's contracted fees and 60% of what the plan pays for non-contracted providers. For orthodontics, as I mentioned on the previous slide, now it's going to be a coinsurance-based benefit. So when you visit, you can visit again any dentist now under this plan after January 1st, and 50% will be covered of the PPO and premier providers' contracted fees and 50% of what the plan pays for non-contracted providers.
Hi, Marissa. We had a question come through the chat, actually a couple of questions.
Sure.
One is regarding the new $2,500 limit for ortho. The question is, can it be used when care has already started? And this pertains to the PPO plan.
So, and I guess the answer to that, I'll answer that in a couple of different ways. So it depends on what, because I'm not sure if this member is seeing a Delta Care DHMO orthodontist or a non-DHMO orthodontist today. If you answer, I'll answer the non-DHMO orthodontist first. So if you started care and just went to any licensed dentist and started care and was not a DHMO orthodontist, so you aren't paying the copay, but you are just paying out of pocket for your services. Coverage for this orthodontic benefit that's changing will start on January 1st. So there will be, you might have remaining months of treatment, which your orthodontist can submit a claim for after January 1st. And depending on how much time is left in your treatment, you can access this benefit for the remaining months of treatment. What cannot be accessed is for any treatment that started prior to January 1st. However, typically, orthodontics is a 2-year process. So if you're in the middle of treatment, and let's say, you have that you have started and you've gone through 6 months of treatment, and now let's say you have 18 more months left, then depending on what that provider is charging for that monthly cost for the remaining 18 months, they can submit that to Delta Dental as a claim. And then if you are seeing a DHMO orthodontist today and you started your treatment with a copay, after open enrollment is completed, the employee benefits team will be sending out an email to gather information if you are mid-treatment with a DeltaCare DHMO orthodontist, so that we can accommodations can be made so that you and your dependents can continue to visit that same orthodontist under the same coverage that you have today.
Excellent. We had another question. And this is in regards to the HMO PPO, again, orthodontia. Under Delta Care, is it 100% for orthodontics? But if you go outside the network, it's covered at 50%. That So we just need some clarification on in-network and out-of-network.
So what happened, and I'm not sure if I'm understanding the question, but what happens for orthodontic care when you visit a PPO or premier dentist, they will have a contracted fee for that comprehensive treatment. So let's say it's a 2-year comprehensive treatment, banded braces, and you haven't started yet. That provider will have a contracted fee with Delta Dental. You're under this benefit now, 50% of their contracted fee up to the lifetime maximum of $2,500 will be covered. Your portion will be 50%. And then so let's say the treatment, I'll just give an example. Let's say their contracted fee is $6,000. 50% of that is $3,000. The lifetime maximum is $2,500. So you will pay the $3,000 plus the difference, so that additional $500, because the plan will now cover $2,500 of any orthodontic treatment, and that's a lifetime maximum. So it is a very generous lifetime maximum. And for orthodontic treatment, but we know that orthodontic treatment can be costly, so you might exhaust that $2,500 and might have to pay, you will pay that 50%, and you might have to pay a little bit more than 50% is what I'm saying. I don't know if that answers the question.
Thank you. Yes, thank you, Marissa.
Sure.
A couple of more questions. If you can explain, are annual maximum per calendar year and orthodontic lifetime maximum the same meaning as maximum out of pocket?
So, so for the calendar year maximum, that is not the maximum out of pocket. That is the maximum that the plan pays. So, so if you are having, services outside of orthodontia, that is when the annual maximum of $2,500 is utilized. So let's say you're having a a crown, or and 70%, and you're seeing a PPO or premier dentist, and 70% is covered, and that provider's contracted fee is $1,000. The plan will pay $700, you will pay $300, and $700 will eat away at that $2,500 annual maximum. So that it's not the maximum out of pocket, it's what the plan pays.
Excellent. Thank you, Marissa.
Sure.
Another question. If I have
Okay.
Delta Dental PPO and I'm also covered under my husband's Delta PPO, will the plan cover the orthodontics 100%? For example, 50/50?
So I'm not sure if it will cover 100%. And what I will say is that what I would suggest is that you check to make sure that your spouse's plan allows for coordination of benefits. And typically, if their plan allows for coordination of benefits and you have both plans, then you can, definitely, cover more of the orthodontic costs. I'm not sure what that cost, the overall cost would be, so I can't say if 100% would be covered, but definitely you could access both plans with coordination of benefits, because if they're both PPO and they both allow for coordination. So definitely something to check with your spouse's employer to see if that plan allows for coordination. And then, there is, with coordination of benefits, if you are covering your dependents, there's also, then it through what's called the birthday rule, it's determined which plan is primary and which one is secondary. So if, depending on whose birthday comes first in the year, not who is older, but whose birthday comes first in the year, determines which plan is primary for your dependents, if you should have dependents covered as well.
Another question, Marissa.
Yeah, sure.
Do diagnostic and preventative costs add up to maximum PPO coverage of $2,500?
That is a great question and a great segue into my next slide. So for your PPO plan, what the county has, which is a great benefit and allows your now what will be $2,500 annual maximum to go even further, is what we call a diagnostic and preventive maximum waiver benefit. So what this does is that any services that are rendered through diagnostic and preventive, so your cleanings, your exams, x-rays, anything that falls under diagnostic and preventive does not eat away at your annual maximum. So it does, in a plan without diagnostic and preventive maximum waiver, let's say $350 was charged in this example, your maximum remaining would be $2,150. With the diagnostic and preventive maximum waiver that you have available to you, that $350 that's covered at 100% when you visit a PPO or premier dentist does not eat away at the $2,500. So you can still use that annual maximum for your basic and major services. Another thing to note that's really wonderful about this benefit is that, let's say at the beginning of the year, you utilize your annual maximum for major, services, and you can still go in for your cleanings, and this diagnostic and preventive maximum waiver, still applies. So you still would be able to go in for those cleanings and x-rays the rest of the year and not have to pay anything out of pocket, as long as you're visiting a PPO or premier dentist. So next I'll just touch on some other features of this plan that I think are really Important to note, so pre-treatment estimates, pre-treatment estimates are great when you're having services that are more costly. So I always recommend that if you're having your provider is suggesting treatment that's over $300, that you request a pre-treatment estimate from your provider. Basically, what they do is they will send us all of the information, and then we will basically, almost adjudicate it like a claim. So we will provide, a statement to you and to your provider before you have the services rendered of what your out-of-pocket portion is going to be, so that you don't have any surprises when you go into the dental office. So you really have that estimated cost available to you. And I think it's a really wonderful feature of this plan, and I highly recommend it. Another feature of this plan, as I mentioned, you can visit any licensed dentist, and that includes any licensed dentist in the world. So under the PPO plan, if let's say you are out of the area and or out of the country for some reason, and you're experiencing a dental emergency, you can access care wherever you are, and then bring back any sort of claim information, any documentation from the provider that treated you, and an invoice or receipt or billing statement that details what the services were that were provided and teeth treated and the information of the provider, and then submit that to Delta Dental, and we will adjudicate it as if it were a claim with a non-contracted provider, and you will receive the reimbursement for the services that were covered and the amount that was covered. You also do not, if you find yourself in this type of situation, you do not have to translate any sort of documentation that you have or convert currency. We will do that all for you. So I know we answered a lot of questions about transitioning orthodontic care from the benefit as it is today under the PPO plan to the new benefit that will be in under the PPO plan after January 1st. I mentioned for any members that are mid-treatment with a DHMO orthodontist that employee benefits will be reaching out after open enrollment to gather information from you so that accommodations can be made to continue your treatment with your orthodontist and the coverage that you have today. And I know we've answered this question already, but if you are mid-treatment with for orthodontic services and not seeing a DHMO orthodontist, you can let your orthodontist know that your benefit is changing on January 1st so that they can submit a claim for any months of remaining treatment that you might have with that provider.
Hi, Marissa. We have a
Yes,
few questions if we can go through these real quick.
sure, of course.
All righty. So on the PPO, are we still entitled to 3 cleanings per year? And with 3 cleanings, 2 exams, and once yearly of x-rays, that would exceed the $350. So then it would go against the yearly maximum benefit. Is this correct?
Oh, and I'm sorry if that was confusing. Was an example. So let me go back to that slide. So this was an example of what that diagnostic and preventive treatment might cost. Under this diagnostic and preventive maximum waiver, any costs that are spent towards diagnostic and preventive services do not eat away at that $2,500 annual maximum.
Great. Thank you for clarifying.
Sure.
And could you confirm if under the PPO plan, if there are 3 or 2 cleanings allowed per year?
I believe that it's 3 cleanings, but I just want to make sure before I I believe so, but I will have to double check and get back to you.
And I can actually answer that question. I have a copy of our comparison chart available. Under the PPO plan, there are 3 cleanings within a calendar year permitted under the plan.
Thank you, Nidra. I appreciate that.
Absolutely. Sorry, I pulled that up right after the question
No,
and
I appreciate that. Yeah,
let
I have my presentation up, so I don't have those details right in front of me. So thank you.
teamwork. Absolutely. Another question has come through for the individual who came in a little late, just asking a clarification question regarding the PPO plan. They are asking, is the PPO the plan that covers 80% of charges? And the reason for the question, elaborating, I went to the dentist and paid $30 for a cleaning, and it was not covered for my cavity, and my partial was $1,000 after insurance. So, what plan covers the most so my copays aren't so high? What would be the recommendation?
And I'm not sure what type of provider you saw or this member saw, but I would encourage the member to, to see what network, if their provider is contracted with our PPO or Premier network, because it sounds as though this member went to a non-contracted provider. So that provider is charging more than what our PPO and Premier providers would charge with their contracted fees. Um, and the plan covers, the plan covers a specific or not specific amount, but the plan covers a certain portion out of network. So for various services, and so you could have more or be balanced billed over what the plan covers for various services out of network with a non-contracted provider. With a PPO or Premier provider, when it says the plan pays 80%, let's say for basic services like a filling, the member's portion is 20% of that provider's contracted fee. So the provider cannot charge the member over their contracted fee if they're going to a PPO or Premier dentist.
Right. Thank you. Uh,
Yeah.
Marissa, could you clarify, or are you aware if the county allows coordination of benefits under our policy or summary of benefits?
Um, so I believe the county does allow for coordination of benefits.
Okay, excellent. Let's see. We have one more question that has since come in, and it pertains to one of your slides, I believe, adding a spouse. Can you please show the slide that shows the amount for 2 persons now under the dental program? Is there a slide? Um,
I don't know that I have a slide that, um,
2 persons? Let me
no, I
select.
did not have, a slide that might be referencing what the contributions are for the plan. And I know that I don't have that information included in this presentation.
Got it, got it. And for to just elaborate more, if the individual's asking about the rates or premiums and flex credits that the county offers, that will be available later this week. Um, so I hope that helped.
Yeah. I believe that might be what that sounds like that to me as well.
Okay, let's see. Another question. Does the DHMO cover cavities, broken tooth fillings, and how much we have to pay from our pocket?
So there are limitations and exclusions, just like with any plan. And so I'm depending on, what the length of time was that filling has been in place, that could determine what is covered versus what isn't covered. And so, I would definitely encourage the member to look at the co-payment schedule, and that also includes some limitations and exclusions. And then, similar to what I mentioned as far as a pre-treatment estimate request on the PPO, on the Delta Care USA plan, the provider, when, there is treatment being recommended, that provider should be, providing the member with treatment plan that outlines the co-payments for the services that provider will be rendering for that member. And at that time, that really gives the member a great opportunity to have a discussion with their provider on, what's covered, and if something isn't covered, why it's not covered, because they, you can provide that information. The member is always welcome to call the contact center if they have a treatment plan available to them. But certainly your provider is, I would suggest that the provider, their office is really a great place to start in understanding what is covered under the plan for you in that specific situation.
Thank you, Marissa. I believe that's we don't have any more questions in the chat for now. Keep them
Okay.
coming, everybody.
Yeah, these are great questions. I love it. And I'm going to, and I know I've kind of touched on this a little bit through the last portion of the presentation when we covered the PPO, but this next section is talking specifically about the PPO plan and the various networks. I mentioned that with a PPO and Premier providers that you are saving the most when you visit either PPO or Premier providers. And then with non-contracted providers, those providers can balance bill you, and you might owe more than you were expecting to pay when you visit a non-contracted provider. You'll notice the PPO provider little savings piggy bank here is a little bit larger with PPO than it is with Premier, and that's only because our PPO dentists do discount their fees more when they contract with Delta Dental than our Premier dentists. However, both discount their fees. You have cost protection with both networks. It's just that your annual maximum dollars would go farther for you with a PPO dentist just because their contracted fees are typically less. Just in this slide here, just to give you an idea, on average, when a provider contracts with us in their PPO network, their average discount is 39%. For Premier, it's 20%. And just to give you an idea of the availability of providers in these networks, we have over 150,000 PPO and Premier providers that are contracted with us at over 440,000 locations, and nationwide, 8 in 10 providers are either a PPO or a Premier dentist. So certainly, and I think it speaks to that, maybe a member that might be visiting a non-contracted provider. I know that if you've been going to your provider for a long time, that you might really like your provider, but if they're not contracted, you definitely have options available to you. So I would encourage you just to go on to our deltadentalins.com website, and you can so when you're looking for DHMO orthodontist, you're looking for Delta Care, the Delta Care USA network. When you're looking for a PPO dentist, you are going to be searching. You can select PPO and Premier. So once you get into the search results, you may select PPO at first, but you can go into the filters and add Premier or vice versa so that you're searching from both PPO and Premier networks of providers. And that way you can see all of the providers that are available to you in your area.
Marissa, quick
Oh, sure.
question regarding
Yeah.
providers.
Mhm.
Inquiry came through. If our provider switched from PPO to Premier, can we still see them?
Yeah, of course. Of course. If they switch from PPO to Premier, you're still under the PPO plan, um, you can access, like I said, any provider including PPO and Premier are both networks that are available under the PPO plan.
Great. Excellent. Thank you.
Sure. Now I'm going to talk a little bit about member perks and the member perks that are available to members through the County of San Diego. So we have a number of options. I know that many of you are probably seeing your providers in person, which I think is wonderful, but we still have the availability of remote consultations with the provider through virtual dentistry. And that is just, that is an option that we still have available for our members. We have a partnership um, the Brush Smart store. So all of the suite of products that are offered through the Brush Smart store, which include, um, might include Quip, Philips Sonicare, all of those oral healthcare products are available with discounts for County of San Diego members. We still have our partnerships with Amplifon and QualSight for hearing aid and LASIK surgery discounts. One of our newer partners is Life Perks, and I'll go into a little bit more detail on Life Perks on the next slide, but we do offer discounts on a number of products and services through Life Perks. And then finally, we have our wellness resources, which are always available on our website, and a really great number of articles, tooth-friendly recipes, videos about oral health care, all are available to members online. As I mentioned, Life Perks is one of our newer partners. So we have through Life Perks, we offer discounts on a wide range of services, including childcare, financial auto and travel, memberships to gyms, and discounts on fitness gear, entertainment discounts, and then discounts on more oral healthcare products. And just, wide variety of discounts are available to you. If you like, you can register through this website. And then, I myself have registered, and I get an email about, well, I think I've set it up for once a week or once a month that just highlighting discounts that are available to me. And I think it's a really great program. Now moving into our web and mobile resources. We have a microsite or website that is dedicated to the County of San Diego through deltadentalins.com /County of San Diego. And you can go to this specific dedicated site to access your benefit information, some articles and flyers that are available to County of San Diego members. You can also go to our deltadentalins.com site as well for additional information. Some of those articles and teeth-friendly recipes and videos that I mentioned are available on our website. If you go to the County of San Diego site, you can link over to our website as well and access that information. And of course, what most members go to our website for is to search for a network provider. So certainly, really a lot of really wonderful, options that you have on our website. I think I've mentioned a few times throughout this presentation, how beneficial it is to sign up for an online account. For any member, whether you're on the DHMO, the Delta Care DHMO, or the PPO plan, I encourage you to sign up, register, and enroll online. It will allow you to look up your benefit details, to see what's covered under your plan. You can view and print your ID cards, which I'll get to in a second. You can look up the estimate for cost of your procedure for PPO plan members. And for PPO plan members, once a claim is adjudicated in our system, you can sign up to receive a notification via email that it is online and ready for you to view. You can also submit questions to customer service. Something that you can do online, which you can also do by calling customer service, and I'll show you how to do that in a little bit as well. I mentioned printing an ID card at home. Whether you're a DHMO member or PPO member, you don't necessarily need your ID card. You can go to deltadentalins.com and log in to get your ID card. You can either print it, you can also save it to your wallet if you are using our mobile site. So you have a lot of options with your ID card, but most often a provider will have your information before you even walk into their door. Now we're going to talk a little bit about oral health and wellness. As you know, Delta Dental, we really want you to, go in for your cleanings and, because your oral health is very much connected to your overall health. And really to that end, we provide a lot of resources for our members on our website. So I've mentioned this a couple of times as well, but we have over 100 articles about about your oral health and wellness, tooth-friendly recipes, quizzes to assess your risk for periodontal disease or cavities. And then we have some videos that cover a wide range of topics as well. And we have everything for articles about healthy aging to education for children and teens as well. So now talking a little bit about how you can reach us if you have questions. So we have toll-free numbers that are available for County of San Diego members for PPO and DHMO. We have customer service representatives that are available Monday through Friday. Our PPO customer service or contact center is available from 8 a.m. to 8 p.m. Pacific Standard Time. And our DHMO customer service representatives are available from 5 a.m. to 6 p.m. Pacific Standard Time. We also have an automated phone system that's available 24/7. And then we also have through our website an online customer service form that you can complete if you are not able to reach us during customer service hours and you have a specific question that you want to send to customer service. We also have services and our customer service that's available and can not only we have availability in Spanish, but also if you speak a different language or a member of your family speaks a different language, our customer service can bring in a translator that can assist during your call. Our website is also available in Spanish. If you need assistance in Spanish, and so that is available for our members as well. And then we have a number of ways for you to, to connect with Delta Dental and stay up to date on dental information, wellness tips through all of our social media sites. And that is the end of the presentation.
Thank you very much, Marissa. So for everyone who's still on, please feel free to add some questions in the chat box if you do have them. Or if you have some confidential questions, do reach out to the benefits division or to your benefits ambassador to address some, very confidential concerns that you may have. And a reminder, we will be posting a copy of this recording on the Benefits Open Enrollment website. But we will hang tight to allow a little bit more time for some questions right now. All righty, and I see a couple have come in. Marissa, as a member, if my dentist is HMO, but during the year it turns to PPO, is this a change or lifetime event that I can change my dental care plan?
This would not, having your provider leave the Delta Care DHMO network would not be a qualifying event to change plans mid-year. So if your provider leaves the network, they should be notifying you, and so that you are able to find another provider that is in the DHMO network, so that you can, go to that provider in the future.
Excellent. And I believe I can answer this next question. When is the deadline to elect benefits? And I believe this individual is inquiring about the upcoming open enrollment, which will start October 1st and run through October 24th. Announcements regarding open enrollment will be going out this week, and you will be given time to review the plans before open enrollment officially starts. All righty, so let's hear another question here. I have a DHMO and attended an in-network clinic called Delta Customer Service in advance, but was being charged high amounts. Isn't a DHMO more affordable than a PPO? Marissa?
Yeah, so if you went to a DHMO dentist, um, what I and I'm sorry if you've if you feel like you were charged more than the copay schedule for the services that you had rendered and you went to a Delta Care DHMO dentist, I would suggest that you contact customer service, so that if you were charged incorrectly, that you can file a grievance, or have that conversation first with your provider if they charge you incorrectly. If you had services that were not covered under the plan, under the DHMO plan, that could be why your charges were higher than you were expecting. And certainly, definitely, this gives you, and it's a good opportunity to have that discussion. This is why I mentioned having that discussion before when a provider gives you a treatment plan, so that you can understand what services are going to be rendered, and what is going to be covered by your plan, so that you can have that discussion of why the provider is suggesting that procedure that might not be covered under your plan, or if there is an alternate procedure that you can have that is covered under your plan. So really all about having those discussions with your providers, so that you can ensure that you aren't surprised by what you're being charged. And certainly, please, if you do feel that you were incorrectly charged, that is certainly an opportunity to, call customer service and file a grievance with that provider if that's the case.
And for those of you who are perhaps not watching the chat, I just wanted to share with you that my colleague did copy and paste the link regarding life events, qualifying life events that the county acknowledges. So if you want to check that out, it looks like another individual copied and pasted the link for the comparison chart for the plans as they currently are for plan year 2024. Marissa, looks like the chat box is a little bit quiet.
Yeah. I know we answered a lot of questions during the presentation too, which is great. I think that it's always helpful to ask your question and have it answered that moment because it does help, when you're, it does help when you're in the moment to answer that question. It helps everyone else in the presentation as well, I think. It looks like there's a question here. I see one that just popped up.
Excellent.
Does Delta Dental offer a waiver? So basically, if you have an emergency and can't pay right away. So if and I'm not sure if I understand that question, but if there is a large, the way I'm reading it is if there is a large or charge that you weren't expecting, how is there an opportunity to have some sort of a kind of a credit plan to pay for that service. And so typically some providers offer that option. And so I definitely would have that discussion with your provider.
We certainly appreciate everyone making time to participate in this seminar today. And Marissa, I want to thank you for making time and answering all of our questions, covering everything. This is great information, a great resource. I believe we can conclude this seminar. And again, thanks everyone for joining us and have a great day.
Great. Thank you all for your time. Appreciate it.